This image which has 4 phases in it. First, this is a chronic hepatitis B virus infection. So there are 4 phases. One is immune tolerance phase. So in this there is virus, but the immune system is asleep. So immune system is almost sleeping, but virus is there. Virus is multiplying, but immune system is sleeping. That's why this HBeAg is positive in this case, immune tolerance phase, and immune response is poor, and ALT is normal. Also DNA is greater than 1 million international units per ml, but the HCC risk over time is there due to silent replication. So silent replication is going on, but patient's immune system is not, it's sleeping, I'll say. So clinical clue: a young Asian, for example male with HBV and normal ALT, DNA sky high. So action will be, you don't have to treat it. This phase is not to be treated, you just have to monitor ALT 6 monthly. Why you shouldn't treat this condition? Because here ALT is normal, so the liver is not inflamed, and no immune response is there, and this immune tolerance phase, it's most commonly seen in vertical transmission cases from mother to child. So now there comes this immune active phase. Immune active phase means immune system wakes up, so leading to liver inflammation. So the war starts, I will say. War starts here. That's why ALT explodes. ALT becomes elevated more than 2 times upper limit normal, and virus is on the run. That's why ALT is elevated more than 2 times upper limit normal. DNA is elevated more than 20,000, whereas here DNA is greater than 1 million. HBeAg is still positive here in immune active phase, and hepatocyte injury starts. So there is risk of fibrosis, cirrhosis, hepatocellular carcinoma. So if a young adult comes with fatigue, jaundice, ALT 180, for example, HBeAg positive, DNA 40,000, action is you have to treat. Why treat? Because there is active inflammation going on, so there is risk of progression, and this is the only reversible stage you can save the liver here. So this is only reversible stage. Liver injury is going on, so there is risk of progression. That's why you have to treat. Now comes this there is this immune escape phase. Immune escape phase, we know already, this pre-core mutant virus hides this E antigen. So virus hides its identity. ALT is still rising, liver burns silently. So in this case ALT is elevated, and DNA virus is more than 2000. Here it was 20,000, here it's 2000, here it's greater than 1 million. So E antigen here is lost. Because of mutation, but virus is still active, so it has got the maximum risk of cirrhosis plus hepatocellular carcinoma. So if for instance 45-year old patient comes to you, 45 male, he has this HBeAg negative, but ALT is elevated. For example, ALT is 160, and DNA is, for example, 8,000 international units per ml. So you have to treat. Why this looks tricky? Because this immune escape phase looks as if, for example, a patient comes to you, HBsAg is positive, but you do HBeAg, that will come negative. You will think there is no replication going on, but That's why it's tricky. It looks as if this phase is inactive phase, but it's silently destroying the liver. That's why it's deadly, because it's often missed, especially in OPDs. Then comes this immune control phase. Immune control phase means immune system is in control. That means immune system wins. So there is this dormancy is achieved. So in other words, we can say virus is in jail, immune system is in control. So ALT becomes normal. That means though no liver injury is going on, no proliferation, and anti-HBE. So this anti-HBE antibodies are formed, and HBE antigen becomes negative. There is seroconversion from HBeAg positive to HBeAg negative, and its antibody is formed, and virus is in dormant state, but there is still risk of hepatocellular carcinoma, especially fibrosis exists. So clinical clue is 40-year male, HBeAg negative, DNA is less than 2000, ALT 30. So you just have to monitor do not rate. So there is a trick. So 40, for example, male patient comes to you, HBeAg for example negative, but HBsAg positive. Same case, 40 male, HBeAg negative, but HBsAg positive. There can be two scenarios. This could be a pre-core mutant or immune escape phase, and this could be immune control phase. So you just have to look at ALT. If ALT is much elevated here, for example greater than 2 times upper limit normal, so liver injury is going on, so this might be the case of this immune escape phase. Plus if concomitant HBV DNA is elevated. So for example, if HBV DNA is elevated greater than 2000, so this could be immune escape phase, provided ALT is also elevated. But if this is the same and ALT is less than 2 times normal, or it becomes normal, and HBV DNA also is dropping, plus there is an formation of this antibody, so patient is entering in an immune control phase. So to summarize, for example 20 female, ALT for example 22, HBeAg, for example HBeAg positive, and DNA 1.5 million. So this is immune tolerance phase. So this was the first phase, was the immune tolerance phase, because DNA is more than 1.1 million, HBeAg is positive, there is replication going on, although there is no damage, immune system is sleeping, that's why ALT is normal. Whereas 28 male, for example, ALT is elevated greater than 2 times upper limit normal, EAG is positive, DNA is 30,000. So as you can see, ALT is much elevated, there is liver damage going on, replication is going on, DNA is greater than 20,000. So this is immune active phase. So immune system is working, virus is replicating, liver injury is going on, concomitant, and this is the only reversible phase. Whereas for example 46 male, ALT elevated, for example 112, EAG is negative, DNA is all the 4500. So this is immune escape, this is a pre-core mutant. Whereas for example 46 male, ALT normal, for example 28, EAG negative, DNA 800. So immune system is in control. This is immune control phase. So so to summarize, you don't treat immune tolerance phase, the first phase, you don't treat it unless if it is for example greater than 40 years, or ALT is greater than 1 one time upper limit of normal. This is as per Harrison 22nd edition. What it says is you don't read this immune tolerance. You don't treat this immune tolerance phase unless patient is greater than 40 years of age or ALT is greater than 1 multiplied by upper limit normal, and that's persistently there, because that has the risk of progression or risk of development of fibrosis. That's when you treat. Immune escape phase is usually due to pre-core mutants, and liver biopsy is considered when ALT is between 1 to 2 times upper limit normal and phase is unclear to us, because we mentioned these standards, these benchmarks, ALT greater than 2 times upper limit normal. But what about 1 to 2 times upper limit normal? In that case, liver biopsy is considered. And noted if a patient has HBV virus infection plus metabolic syndrome, in that case there is risk of development of accelerated fibrosis that you have to treat early. And also fibroscan or FIB4 score is recommended before biopsy, and treat with tenofovir or entecavir. These are potent with low resistance. So to summarize, immune tolerance phase is DNA is very high, ALT normal, HBeAg positive. Think too young, too early. Active phase is ALT is elevated, DNA is more than 20,000, EAG is positive. Attack, this is attack mode, you have to treat. Now control phase is ALT is normal, DNA less than 2000, EAG is negative. So this is cool phase. Control phase is cool phase. You just have to monitor. And escape is ALT is increased, DNA more than 2000, EAG is negative. This is enemy hidden. Enemy is hidden here. So you have to treat this condition. You have to only monitor this phase. You have to monitor immune control phase. Rest of the phase you have to treat. So when you are in doubt, you just ask, is the liver under immune attack? If yes, treat. If not, monitor. If unsure, do biopsy or fibroscan. So to summarize, ALT tells us the damage, DNA tells us the viral load, E antigen tells us the stage, and just monitor. Thanks. Just subscribe this channel.